Hi, and good morning, everyone. Welcome to another episode of the series of TBYP tips to boost your knowledge in pharmacology for medical students and students of medical background in general. And here I am with you again, Dr. Marwan. So, this is tip number 3, which comes after previous 2 tips about the general knowledge, the general definition of pharmacology, and the general definition of drugs. Uh, in this tip, we are going to give some few hints about drug nomenclature and how many, to answer the question of how many drug names are there for each and every single drug. So to answer that question, we give an example. We have the common and very famous uh, drug or medication that is used for the treatment of headache and other minor pain and as an analgesic, which is PCM, informally known as PCM, which is paracetamol. The drug name, the medication name is paracetamol. So we can find it in the name of paracetamol. Sometimes we find it in the name of acetyl p-aminophenol, APAP. In other situations, we found it under the name of Panadol, which is the same PCM. In some other cases or some other instances, we find it under the name of acetaminophen. So actually, which one is for us to choose as medical students and also as medical professionals later? So to answer these questions, we have to know that every drug have 3 names, every drug. The first name is the chemical name of the drug, which reflects the molecular structure, and it's important for chemical description of the interactions that can happen with the drug at the molecular level. For example, we just gave the example of paracetamol, which has the chemical name of acetyl p-aminophenol. Uh, the other example is aspirin, which has the chemical name of acetyl salicylic acid. But do we use the chemical name in pharmacology in general and in drug prescription in specific? The answer is no. So what do we do? What name that do we choose for using in describing the drug or in calling or in naming the drug for pharmacology and medical practice in general? We actually are going to use the generic name. Generic name is the approved name by the FDA, and it is a non-proprietary name that is accepted worldwide universally for each drug specifically. So this is approved, as I mentioned, worldwide by the FDA, Food and Drug Administration. And this name is accepted universally to remove the confusion about drugs with similar or close to each other in their names. Uh, and in the generic name, we always don't need to capitalize. So if the name of the drug comes in the middle of the sentence, like aluminum hydroxide, we start with a small a. The third name of the drug that can happen for us to see is what is called the brand name or trade name, or another name is proprietary names. How to describe brand name? So this name is given by the manufacturing company. So each drug has manufacturing companies distributed throughout the world, and in every country, the company might choose to name the drug in a way that differs, that is particular for its own company for marketing purposes. So, for example, for paracetamol, we have we have it commercialized or marketed under the name of paracetamol itself, sometimes Tylenol, and sometimes Panadol. So Panadol that we have seen just now in the previous slide was one of the trade names, but not the one that we choose in prescription writing, and not the one that we choose in pharmacology. To make things a little bit more puzzly, you have to understand that drug generic names themselves may differ according to what is called pharmacopoeia. So we have to know what is pharmacopoeia first, so that we understand the differences in generic names. A little bit, there are some differences in generic names sometimes for some drugs. So the pharmacopoeia is actually is an official reference which contains a selected list of the established drugs, and these pharmacopoeia references are produced by certain countries, such as United States. We have the United States Pharmacopoeia, and England, British Pharmacopoeia. We even have the Malaysian Pharmacopoeia. But here in Malaysia, usually the name that is followed for generic is the same as the British Pharmacopoeia, and not following the United States generic names of pharmacopoeia. So whenever you find the name adrenaline, so this means that the drug is following or the reference that we are following is a British pharmacopoeia or Malaysian pharmacopoeia too. While adrenaline for United States pharmacopoeia and drug nomenclature, we find it under the name of epinephrine. So this is for you to avoid confusion or to prevent confusion, that if you find in a textbook the name epinephrine, it doesn't mean another substance. It is the same as adrenaline. So that's why it is important for us to know and understand some of those generic differences between pharmacopoeias and between uh, countries that use the different names, so that we don't fall into such a confusion. GTN, or glyceryl trinitrate, the very famous drug that is used for the treatment of um, ischemic heart disease as a vasodilator, coronary and venodilator. We have to use glyceryl trinitrate and not nitroglycerin, although both names refer to the same drug. Hyoscine, we use hyoscine instead of scopolamine. Scopolamine can be found in many American-based or American textbooks of pharmacology and medicine in general. Paracetamol is used here, while the generic name for paracetamol in United States is acetaminophen. So don't get confused. It is the same name of the medication, but two different generics based on the pharmacopoeia that it follows. Salbutamol, here we have to use salbutamol following the Malaysian pharmacopoeia, which also follows the British pharmacopoeia, while in the United States, the same salbutamol, they use the name albuterol. Furosemide, only a minor spelling difference between the British approved name and the United States approved name. Furosemide. So these pharmacopoeias are usually updated to add some new medications and drugs that are added yearly, maybe annually, or every 2 years. So these are the examples, and with this we end the tip number 3. Thank you very much, and see you again with another tips of TBYP. And thank you.